Hello, how are you guys doing? Welcome back to yet another video, and if you're new, then what the is up? It's Elsie Man the G. Thanks for clicking, you guys. And then today is my 2-week follow-up update, you can call it, on my ACL surgery. And now again, if you guys haven't seen the video, but I did only have my ACL reconstructed. I don't see the surgeon till Monday, July 1st, to follow up with him since the surgery, but apparently my meniscus didn't need to be repaired, so hopefully it was just a actually small tear and it kind of healed on its own, I'm hoping, but only ended up needing my ACL reconstructed from my patellar tendon. So I do have still some steri strips in the front of my knee, and then on the side of my left kind of lower thigh-ish area where they went in. But 2 weeks in, you guys, my knee feels less heavy, less pressure, especially when I'm standing up and using the crutches. And then it is getting a little bit more easier to move my leg around without any discomfort. I still cannot move my leg on its own if it's not while standing up to walk. So that was kind of why I was super frustrated up until this point, because I could before, and now I can't lift it up or move it. I have to do it all manually. So that's my 2 little week update. Physically, my knee is still swollen. I still feel like some numbness, tingling, my knee area and the top half of my shin. It is still bruised in certain areas, of course, and then I can't move my leg at all without having to manually do it. A 2-week follow-up on my mental health, we could call it. I've been struggling, I'm not gonna lie. I not being able to move my leg kind of put me in a concern, but I guess that's normal. While I'm feeling better and only having to take the meloxicam for the inflammation that I'm still doing, the swelling, and just the baby aspirin, I feel like because I feel better every day, I want to do more, but I can't do more. So it's like a battle between myself and then a battle between, thinking positive and then keeping all the negative thoughts away. But, it's just, I'm human, the struggle of wanting to go out and do things for summer. Here in Oregon, it's actually been pretty good, hot, sunny days, which we don't get a lot of. So, I get down, I'm not gonna lie, when I see my friends posting, they're out in the lake or hiking with their dogs, so it gets to me. But I know that all this will pass, and I'm gonna do all I can to do all my exercises to the best that I can, and push myself to where I won't injure myself, of course. But friends and family are checking in up on me, and that helps a lot too. Sometimes I do get annoyed, but it's them trying to be there for me. But yeah, today I had my first physical therapy appointment. It was kind of hard just to get out. I haven't been out since my surgery day, so like getting into the truck was a little bit of a struggle, and then by the time I got back, I was just tired. I had to take a nap, because first time being out. But physical therapy went pretty good. Just chatted up with my physical therapist and went over what my goals were for after therapy, or what the goal was for therapy, and we'll try to get there. She did mention that while we'll keep working, there is kind of like a 6 to 8 week window, sometimes even 10 weeks, where you really have to push hard to get the best of your range of motion, because after that point it's kind of like, that's whatever you kind of reach during that time is basically what you're gonna have basically for the rest of your life, so we really have to work between that 6 to 8 week window to try to get the best with my bending and everything. My extension right now is measuring in a -1 degrees, so that's really good. And I had been working my extensions prior in physical therapy before surgery, so that helped a lot. The bending wasn't my best even before surgery, so I'm really gonna try to work on that, because I do want to try to get the best bending possible within that 6 to 8 week mark. Hopefully I do get the 10 weeks, but I'll try to do everything I can again, to get the best range of motion back. So it's good knowing that, because I do have I have obviously time to heal, and I'll be doing physical therapy for sure for 12 weeks to 3 months. I do want to, knowing that I definitely want to push myself to the best and the hardest I can without hurting myself again, to reach my goals, which is, hopefully getting back into the gym and hiking and running. She did want to try to get me back into playing soccer, but I don't know. I think once my mind knows that my knee's okay, maybe I'll try, but it's just kind of like scary going back to soccer, but we'll see. One day at a time. I keep telling myself, this journey, this time of my life has been a big test, just for myself, my character. I get emotional talking about it because it's been a lot, but it all just will be a story. You have to think positive if you're going through this. It's one way of thinking is, yeah, it sucks, but we're choosing to do the surgery, to get back to our love for being physically active, right? To get out there again and have no limits, really, you could say. And I am gonna be able to walk. There's unfortunately people out there with that have accidents who can't walk anymore, or unfortunately have to have no leg anymore. So that's what keeps me going, you guys, when I'm feeling down. I have been in a funk, I'm not gonna lie. This last week or couple of weeks, just it's rough, and what are we gonna do? One day at a time. Well, I do see improvements. There's also just, why can't I do more yet? But again, one day at a time, you guys, is what I keep saying. It's all we can do. Is just look forward to I guess it's most knowing that you're doing the best to recover, and not try to let the frustrations get to you, right? But that is my 2-week update, you guys. I'll try to make a video soon on the new exercises I'm doing, just in case they're of any help to you. I know sometimes, at least here, it's been pretty crazy to get in to see your doctor or physical therapist. Luckily now, since I'm established somewhere, I'm already booked out quite a ways, so I'm able to see my therapist regularly. I'm going to therapy 2 times a week. But I'll put up a video with the exercises, just in case you're kind of in the same situation. Just make sure that you give your surgeon or something a call, or if you are aware that you are aware of your restrictions, if you have any, before you do any of the therapy exercises that I'll be putting up hopefully soon. But I did want to show you guys something I did not know. It's a cool scoop thing you can do if you're not able to move your whole leg yet. I didn't know about it, so I manually have to grab my leg and move it, to get onto my bed or to sit, like anything really. And I had either been using my brace Velcro to lift it up, or I grab my calf and move it. But I'm going to show you right now what my physical therapist showed me. Excuse my dirty floor, but you basically get your good foot and put it under, so you make like this motion, put it under the bad foot, and you scoop it up. Let me see if I can record myself doing it. Scoop it. Pull it up. Turn. Okay. Like that. And then grab. Yeah? And then you can do the same to get down. So this is a good method I didn't know about. Sorry, these hiccups. But yeah, you guys, that's about it for my 2-week update. I guess it's been more of a mental challenge. Stay positive, one day at a time. Have friends, family around calling you. Be in a place with the window, if you got a window, place with the window, and listen to some good music. Cry if you have to cry. Laugh, get angry. But we really have to be disciplined with our exercises to recover the best, right? So 2 weeks in, still doing the meloxicam, by the way, for the inflammation. I'm not really having so much pain, just maybe sometimes at night. Still just sleeping 3-4 hours, then get woken up to get readjusted. But you guys, it's a tough road, but we will come out of it. You guys have a good one.